introduce themselves on camera again, and then if you got questions, we'll go. So we'll start with KP, and then we'll go with Dr. Beasley.
Good morning, everyone. Kirkpatrick Tyler, Chief of Government and Community Affairs for Urban Alchemy.
Megan Venable Thomas. I serve as the Director of Community Development for the City of Birmingham.
Can you tell us a little bit about what's going on today?
Sure, we are very excited to be launching another opportunity for folks who are experiencing homelessness across the city of Birmingham. This is for us to do a community-based public safety and call center with our partners at Urban Alchemy, who will really be able to divert calls from 911 and 311 to receive those calls that are related to our unsheltered folks and to be able to respond to them, to give them the direct coordinated care that they need to move into the system and to move into potential housing opportunities that meet their needs.
$1.7 million could go a long way. How big a deal is this in an effort to improve the situation for so many of the least fortunate in our community and city?
Yeah, I think it's a really important kind of cog in the wheel and pipe in the pipeline, because oftentimes our unsheltered neighbors don't have a resource that sees them, right? That can connect with them, that has empathy and understanding. And so Urban Alchemy actually is compiled of about 98% of folks with lived experience, which really changes the dynamic, because now it's not one punitive, but also it's a person coming to them with lived experience, with an empathetic ear and an understanding of what they've gone through. And usually it takes about 75 touches to get a person to consider moving from unsheltered homelessness into shelter. And so with these teams on the ground doing proactive outreach, which means being able to connect with folks before a 911 or a 311 calls, then being able to engage and respond to those calls now instead of a punitive relationship, because we've already connected, being able to say, hey, we know that this challenge is going on. Is there a way that we can help you? And that trust building actually helps us to move folks from unsheltered and street homelessness into shelter, connected to resources that are available. And as the city grows its homeless resource support, our teams will be able to get folks moving more quickly through the process. And so it's kind of like we could build a bunch of stuff and not have the kind of the transport to get folks from the street into the housing resources and into substance abuse and mental health support. So it's really partnering both the street outreach and engagement and the long-term resources that are at the end of that pathway.
But right now there's not really a place yet. They're still trying to figure out where this is going to be housed. Is that right? Did I hear that right?
Right, so part of our planning process is to engage and understand how this call center will work, how it will operate with our local context, and where that call center would be best to be housed. And so part of our process over the next 60 to 90 days is to identify where that location will be that is at the intersection of where people are needing to be served and what works best for our 911, 311 operations. And so we look forward to kicking this process off after today and seeing where this is going to be housed to be able to begin services.
What else do you think is important for people to know just about this project?
I think that probably the key thing is to know that this is a program for and by the people. I know that a lot of folks are probably feeling concerned or alarmed about Urban Alchemy not being an organization that came from Birmingham. And I think the first thing that I would say both to our unhoused neighbors as well as to our housed neighbors is that we're not kind of just parachuting in to come and save Birmingham, but the model that we use comes and connects and engages folks who are from the community, that are from the neighborhood, that have the connection, and then empowering them with the training, the skill sets, the resources and support to engage their neighbors and their community. I think that's really important because that is the beginning of trust building, right? Making sure that that folks understand this is not us coming to do something for the city of Birmingham, but that we've come to partner with the city and with the people of Birmingham to engage and help to make a change and contribute really to the work that's already going on. There are a number of amazing service providers, and we're really just excited to now be a part of that service fabric that will help to serve our most vulnerable neighbors.
Sir, could you kind of highlight, with so many that are partnering with you and so many with past experience of their own, can you highlight why this is necessary? That this is a problem that has grown, and we're trying to find a way to better the situation.
Yeah, so I think really the conversation starts at the national conversation that was being had at the murder of George Floyd, right? That we had to have some type of intervention that did not involve law enforcement, but that took a community approach to engaging our family members and community members when they were in a mental health crisis or needed some simple support. Even our friends and community supporters from law enforcement have said that they would prefer that someone who has the resources, the skill sets, the relationships to engage our unhoused neighbors, that they would prefer that type of approach. And that would allow law enforcement to focus on more critical incidents. But that this is the piece that allows us to have a more humane, a more community-based approach to working with folks who aren't a danger, who aren't going to do harm, but just need support. I think this important and critical piece of the dispatch center is something that Urban Alchemy is most proud of. To be able to transport those calls from a 911 or 311 operator and getting it directly to folks on the ground from the community who probably already have the relationship, who already are familiar with the area, and who are probably familiar with the challenges that exist with the person that the call is concerning.
Last thing for me, from an operations standpoint, when can we see this operational and making a difference in our community? I know a lot to be figured out.
Yes, so we're excited to see something at the beginning of the year. So we're going to be working hard after today to really get started and to get things rolling.
How many employees will you have in Birmingham?
So I think that's still a part of what we're working out. Our average heart program usually is somewhere between 15 and 20 practitioners, depending on the size of the service area and the rollout of the shifts that they'll be serving on.
How does that break down with call center versus people on the street?
So our street teams usually are made up of 2 practitioners, 1 mental health clinician. Our call center, again, depending on the size of the service area, can be anywhere between 2 to 5 people per shift. And so it really depends on how large this goes, how large the service area, but all of that are things that we're going to work out and build out as we move forward.
What are some of the cities that you're operating in now?
So currently, Heart program operates in Los Angeles, California at Circle, and then Heart, the program operates in San Francisco and Austin, Texas as well.
A lot of people in Alabama might say, well, the homeless problem looks pretty hopeless in California. Would you say that you have made strides towards?
Oh, absolutely. Yeah, I would push back, not so much that everything is perfect, but that we've seen a significant increase in Los Angeles particularly. We saw the homeless numbers drop significantly under the last homeless count. We've seen, because we've stood up more shelters, more interim housing opportunities, and because we've had interventions like Circle in Los Angeles and the Heart program by Urban Alchemy, that we've seen more folks being willing to go into interim housing and be connected to permanent housing from there. And so I think if we're looking for this to be a magic bullet, the answer is no, it's not. If we're looking for this to be another viable resource that brings about transformative change, then Heart is a program that we'll see make a grave impact in Birmingham.
Do you have a percentage goal that you look for hiring formerly incarcerated individuals?
Yeah, as an organization, we're 98% formerly incarcerated.
That's the call center and the street workers.
Yes, sir.
Does that sometimes cause problems with if there's a recidivism or relapse that they could become a problem on the streets?
So we haven't faced that. Urban Alchemy has a under 2% recidivism rate nationwide. But we also have a number of resources and supports, not just for the folks that we serve, but also for the folks that serve with us. So when an individual is in crisis, even if they're a practitioner as a part of our team, we do a lot of work to help undergird and support them while they're going through.
Can you just say and spell your first and last names again for me, please?